Pfizer's going to pay $2.3 billion in the biggest fine ever for deceitful drug marketing. Well, it just so happens that Pfizer and a couple other companies that we're going to talk about today are leading the way in public health right now. They're making something that you may have heard about, like a little shot that a lot of people are getting. And the fact is that these companies are very dishonest and have been fined billions of dollars over the past 20 years. And so I think we should pay attention to this because they kind of have a history of being criminals, okay? But before we get started into all of this very unsettling information, I'm Dr. Zarowski and welcome to the channel. Be sure to subscribe and hit that notification bell. And you want to hit the notification bell because subscribes are not going to let you know when new videos are released on this channel. And I'm talking about some of the most the health news that you're not going to get anywhere else. Nobody else wants to talk about it. I break it down. I'm real with you guys, and you're going to want to make sure that you get all the new content that comes out. So hit the notification bell, and then to check out my whole catalog on natural health videos, be sure to go to www.drz.tv, and you want to be there because you want to take care of your health naturally, because that's the only way that you get true health, not through all this nonsense that these guys here are peddling. So let's go ahead and jump into this. So first of all, Pfizer, okay? This company is considered to be, doing God's work today out in the world of healthcare. But let me tell you, the information that I'm about to give you is going to let you know that, well, they're really nothing more than criminals. Now, let me say this too, because with all the COVID stuff going on right now, one of the first things I had said from the very beginning, when I heard that, these certain companies that were basically given some of the contracts for some of these shots, I said, you know what the worst part about it is that they're using companies that are known criminals. They're known crooks. They aren't good people. Well, Pfizer happens to be one of them. So right here, back in 2009, they were fined $2.3 billion for deceitful drug marketing. Now, how does that make you feel that the company who's producing something in mass production right now, one of these shots right now, they were fined $2.3 billion in 2009 for deceitful marketing? And you think, oh, everybody makes mistakes, Dr. Zarowski. You just got to let them off the hook for that one. Oh no, there's more. There's more. Let's go ahead and jump into some more juicy information that's going to let you know how bad it really is. Okay, so 2009, Pfizer, $2.3 billion. Off-label or unapproved promotion of medical products. Basically means that they were, promoting things falsely, okay? Oh, Pfizer in 2016 for $784 million. Oh, false claims. Okay, making false claims. All right, well, let's just stick with Pfizer, okay? Now, there's lots of them here. You can see clear as day. There are a lot of companies involved in this kind of nonsense. Pfizer back in 2009, kickbacks and bribery. Oh, they must have been supporting your local politician that was telling you to use their products and making sure that they legislate that their products are being used in healthcare policy. Okay. Pfizer back in 2008. Pfizer back in 2012, Pfizer in 2002, 2012 again, 2019 for the false claims. And that's the other thing is you got to look at, like, okay, well, what is Pfizer doing? Why are they causing so many problems? Well, 2012's Foreign Corrupt Practices Act. Now, the one thing that most people don't know is that this company's actually been kicked out of other countries for actually using unapproved products on people, like in basically they died in the process. They were going out and testing on humans in foreign countries, and these people were dying. The countries actually kicked them out, said, you guys get out of here. What you're doing is despicable. Okay, Pfizer in 2018, false claims. Pfizer in 2002, false claims. Pfizer in 2013, false claims. Look, you get the point. You get the point. Like, these are dishonest, corrupt people, or companies, I should say. This is a corrupt system. These guys are criminals, okay? And we can keep going and going. Look at all the Pfizers on here. My gosh, not to mention they've been fined. I think it's upwards of $4 to $5 billion since the year 2000. So anyway, you better be real careful who you are going and putting your good faith in today's world of close your eyes and take the medication or the shot. Okay, you better be very careful. You say, well, Dr. Zarowski, that's Pfizer. There's other companies out there. Oh, really? Okay. How about Johnson & Johnson? Well, we could trust them, right? Well, Johnson & Johnson to pay more than $2.2 billion to resolve criminal and civil investigations. Allegations include off-label marketing, kickbacks to doctors and pharmacists. Hey, you know what? Prescribe this to your patients. We'll give you a free private jet ride to Hawaii with your family if you just like shove all these pills down people's throat. Come on, just do it. All right, the doctor says, and why not? And by the way, all doctors aren't bad. There's obviously bad eggs in every basket. However, the toughest part is you don't know who's good and who's bad. You know, it reminds me of my wife and I. We went to Mexico, and it was super frustrating for me because we'd meet this wonderful Mexican lady, and she would be so sweet and tell us about her family. And obviously, they want to build relationships with you, so you would tip them nicely and you would treat them good. And next thing you do, you do that. You do that because you're like, what a wonderful person, you know? And then we meet another lady. Oh, what a wonderful person. To only find out that they actually ripped us off and really ripped us off, but we only found out after the fact. And so then you go, man, you don't know who to trust around here. And then next thing you know, you put up your guard and you feel like, at the end, after having a dealing with somebody, you're like, man, I feel bad because I feel like I mistreated them. They really were a nice person, but now I don't know who to trust around here because that other person ripped me off so bad. And the same thing goes when people walk into their doctor's office. They just are like, well, how do I know if I can trust them? They seem smart, they seem nice, but can I really trust them? And, this is why, in general, look for a referral. Look for a referral from a friend if you're going to go to a doctor. That's one of the best ways to do it. I mean, and I have people all the time that come in, they see me, and they have such a bad attitude. And I have to tell them, look, I didn't do anything to you. I'm sorry for your past experiences, but you got to leave them at the door. If you're not willing to leave it at the door and you're going to project them onto me, then I don't think it's going to work out for us here because I'm just not going to deal with this. Because we have problems with patients coming in and mistreating the doctor just because they've had bad experiences. So it is a tough situation, but try to find somebody that went to a doctor that they had a good experience with. Now, I want to go in and just talk about a few other facts because there's some things that are very unsettling just about prescription drugs in general. So we're going to look at a couple studies here, and basically the Department of Ethics at Harvard University states that properly prescribed drugs cause about 1.9 million hospitalizations a year. Think about that. Properly prescribed drugs cause 1.9 million hospitalizations. Another 840,000 hospitalized patients are given inappropriate medications that cause serious adverse reactions for a total of 2.74 million serious adverse drug reactions. About 128,000 people die from drugs prescribed to them, ranking prescription drugs as one of the leading causes of deaths in America. It's actually considered to be the third leading cause, and nobody talks about this. Most places will say it's unintentional accidents. Well, what the heck does that mean? It depends who you read this from. So if you get the statistics from some sources, they go, yeah, it's because of prescription drugs. And then if you read like medical sources talking about like the third leading cause of death, they're like, yeah, accidents. Okay, well, you can't just give people a bunch of prescription drugs that they may not necessarily need and then just be like, oops, sorry about your luck. The European Commission estimates that adverse reactions for prescription drugs cause 200,000 deaths. So together, about 328,000 patients in the US and Europe die from prescription drugs every stinking year. Can you believe that? The Center for Ethics at Harvard states the FDA does not acknowledge these facts and instead gathers a small fraction of the cases. Millions of people have died from prescription drugs, yet most people never hear a peep about it. A big reason for this is the negligence in reporting by the FDA and other regulatory agencies. As the Journal of Law, Medicine, and Ethics states, the FDA is now funded by drug companies. The very governmental organization that's supposed to be protecting you is funded by drug companies. And this is all happening right under our noses. This is actually a little excerpt from Sean Stevenson on Instagram. You can find him at Sean Model. And he's got a little blue check mark. But anyway, he puts out a lot of good information. Now, let's go ahead and talk about the next thing here, and that is, oh, let me fix my screen, is that unsafe drugs were prescribed more than 100 million times in the United States before being recalled. Okay, we aren't going to get into all the details of this, but just look at the facts here. I mean, we're looking at real studies here that just are showing in broad daylight what is happening, and most people refuse to acknowledge it, and they refuse to pay attention to it. I mean, people have their eyes wide shut today with all the stuff that's going on in healthcare. Institutional corruption of pharmaceuticals and the myth of safe and effective drugs. I want to read this here. Over the past 35 years, patients have suffered from largely hidden epidemic of side effects from drugs that usually have few offsetting benefits. The pharmaceutical industry has corrupted the practice of medicine through the influence over what drugs are developed, how they are tested, and how medical knowledge is created. And I've been saying this forever. I think that in general, because some people tell me, oh, Dr. Zarowski, medical doctors are bad. I don't believe that the doctors are bad. I believe that the allopathic model that they function under isn't good, but I also believe that they have been corrupted by the very system that funds them. You know, a lot of people ask me like, well, how come the natural health industry isn't doing a whole bunch of studies, and how come, you know, we have to rely on medicine to go out and do all the research? It's because they have the funding. They literally have all these mega billion-dollar companies that are just sliding in cash like you wouldn't believe for them to get funding for research and everything they need, their schools. This is how they fund it. These companies, these big mega billion-dollar pharmaceutical companies, they are criminals, but in the meantime, they basically are looking to doctors to be their professional salespeople, and they're producing the product. So since 1906, heavy commercial influence has compromised congressional legislation to protect the public from unsafe drugs. The authorization of user fees in 1992 has turned drug companies into the FDA's prime clients, deepening the regulatory and cultural capture of the agency. See that? Cultural capture of the agency. Industry has demanded shorter average review times and with less time to thoroughly review evidence, increased hospitalizations and deaths have resulted. Meeting the needs of these drug companies has taken priority over meeting the needs of patients. Meeting the needs of their stocks, their stockholders, has become prioritized over patients. Unless this corruption of regulatory intent is reversed, the situation will continue to deteriorate. We offer practical suggestions, including separating the funding of clinical trials from their conduct, analysis, and publication, independent FDA leadership, full public funding for all FDA activities, which would be incredible because at the end of the day, the FDA is basically being funded and they're in the pocket of the pharmaceutical companies. Measures to discourage R&D, research and development on drugs with few, if any, new clinical benefits, and the creation of a National Drug Safety Board. So folks, there you have it. I broke it down for you. I gave you the information. Share this with your friend. Make sure that you share this with people who need to hear it, because most people blindly go and they take all these medications, they take these shots, and at the end of the day, you're left with the problem. You know, I tell people all the time, it is my goal to give you the proper information, then you have to make decisions for your health. I don't force people into anything. I don't twist their arms and go, you got to do this, you got to do this. No. It is what it is. I can give you the information, but it's time for you to take action from there. I gave you this information today. You know the truth about these companies. Are you blindly believing them? Put in the comments, what are your thoughts on this? Go ahead and check out also some of my other videos that are going to help you improve your health in a big way. I'll see you in the next video.